Welcome to The Explainer. Today, we're going to tackle a condition that affects millions of people but is, still surrounded by a lot of fear and just plain misunderstanding. Seizures and epilepsy. We're going to move past all the myths and get right into the science of what's actually happening inside the brain.
So let's start with this one idea, possessed. This single word really gets to the heart of centuries of fear. The word seizure literally means to be taken over. And, it's not hard to see why. Watching someone have a major seizure can be absolutely terrifying. It can look like something from a movie, and that has fueled so much of the stigma. So, our goal today is to replace that fear with facts. First, we'll bust some myths, then we'll dive into the actual brain science. After that, we'll trace the triggers, walk through how a diagnosis works, and finally, take a look at what it's like to live with epilepsy every day.
Okay, so first things first, when you hear the word seizure, what's the first image that pops into your head? For a lot of us, it's probably something shaped more by Hollywood than by what really happens in a hospital.
Yeah, the difference between the myth and the reality is it's huge. While those violent convulsions are definitely one type of seizure, that is so not the whole story. A seizure can also be incredibly subtle, like a momentary blank stare, a recurring feeling of déjà vu, or even just a weird numbness that keeps coming back.
And this brings us to a really important distinction. See, a seizure is the single event. It's that storm of activity in the brain. Epilepsy, though, that's the underlying condition. It's the tendency to have those storms happen again and again. That's why not everyone who has one seizure gets diagnosed with epilepsy.
So, if we're talking about a storm in the brain, what does that actually mean? Let's get into the neurology of what's going on during a seizure.
Here's a fantastic way to picture the brain. Think of it like a solar system, just packed with millions of interconnected circuits and orbits, all communicating perfectly. A seizure is like a major disturbance in one of those orbits, and it sets off a chain reaction that just throws all the connected circuits into chaos.
So, when you boil it all down, a seizure is basically an electrical problem. It's this sudden, uncontrolled surge of power, an abnormal wave of electrical activity that just completely hijacks the brain's normal communication network. And it really matters where that electrical storm happens. If the abnormal wave stays put in one localized area, that's a focal seizure, and the symptoms you see are directly related to what that part of the brain does. But if that wave spreads everywhere, it becomes a generalized seizure, and that's what often leads to loss of consciousness and convulsions.
Okay, so this all leads to the next big question, right? If a seizure is an electrical overload, what's causing the short circuit in the first place?
Well, it turns out the answer is complicated. There's no single cause. Instead, doctors have to play detective and investigate a whole range of possibilities that fall into a few key categories.
The origins can be there from day one, like wiring problems when the brain is developing, or they can be genetic. But seizures can also start much later in life because of damage, like scarring from a stroke or an injury. And sometimes the cause isn't even in the brain itself. It's metabolic, a disruption in the body's entire chemical balance.
And get this, here is a perfect and honestly pretty surprising example of one of those metabolic triggers. A notorious cause of new seizures in older adults is something you would never guess: a urinary tract infection. A simple UTI can throw the body's chemistry so far out of whack that it actually triggers a seizure, sometimes even a life-threatening series of them.
So with all these different potential causes, how in the world do doctors figure out what's really going on? Well, the diagnostic process is this really careful and methodical investigation. It always starts with the most important piece of evidence, the patient's story, what happened. From there, doctors do an exam, they run labs, and they use an MRI to look for any structural problems. But the key step is to actually see the brain's electrical activity in action. And that's done with an electroencephalogram, or EEG for short. By placing these little sensors on the scalp, neurologists can directly record the brain's electrical signals. It's brainwaves. They're basically looking for those abnormal patterns that confirm a seizure happened, and can even help them pinpoint where in the brain it started. All right. So once there's a diagnosis of epilepsy, the whole conversation changes. The question isn't, what is this anymore? It's, okay, what do we do about it? How do you live with this and stay safe?
You might be surprised to hear that the first line of defense isn't always a prescription. It often starts with lifestyle. Simple things like getting enough sleep, managing stress, and keeping your blood sugar stable can have a massive impact on controlling seizures.
But when lifestyle changes aren't quite enough, The really good news is that doctors have a huge toolkit to work with. There are more than 15 different medications they can choose from, which lets a neurologist really tailor the treatment to the exact type of seizure, the patient's health, and any potential side effects.
And listen, this next part is so important. I can't stress this enough. Never, ever stop taking your seizure medication on your own. Doing that cold turkey can actually trigger more frequent or even more severe seizures. Any changes have to be supervised by a neurologist.
Living with epilepsy also means you have to think about safety in a new way. And one of the biggest things that comes up is driving. For the safety of everyone on the road, most states legally require a person to be seizure-free for a certain amount of time, usually somewhere between 3 to 12 months before they can get back behind the wheel. And driving is just the start, really. It's all about having a really honest conversation with your doctor about the risks with certain activities, like operating heavy machinery, or even something like swimming by yourself. The goal is always to find that right balance between freedom and safety for everyone. And that brings us right back to where we started. We began with this ancient myth about being possessed, and we end with the reality of a manageable, though often hidden, condition. By understanding the science, the brain circuits, and electrical waves, we can start to make this invisible condition a lot more visible. And hopefully, that helps build a world with way more support and a whole lot less stigma.